Interprofessional education. What is it and why do we do it? Interprofessional and team-based approaches to healthcare and health professions education are sweeping across the U.S. A January 2013 report by the Macy Foundation pointed to the rapid and simultaneous redesign of both healthcare delivery and health professions education, explaining that change in healthcare delivery is being driven by the Institute for Healthcare Improvement's triple aim: improving patients' experience of care, improving the health of individuals and populations, and reducing the per capita cost of healthcare. The reform of health professions education, on the other hand, is being propelled forward by a growing awareness of the importance of achieving team-based clinical competencies as an essential public good. The report noted that a key to these efforts is the recognition that healthcare today involves professionals working together in collaborative, interdependent care systems and in partnership with the people served by these systems. At the University of Arizona, the Interprofessional Education and Practice Program, more commonly referred to as IPEP, is working with academic and community partners to ensure that our health professions education provides hands-on opportunities for students to learn and practice in collaborative team-based environments to provide quality, safe, and patient-centered care. So exactly what is interprofessional education? According to the World Health Organization, interprofessional education occurs when students from two or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. The reason for interprofessional education is simple: the patient. It's all about the patient. It's about better, safer, and higher quality patient-centered care. At its core, interprofessional education is really about learning together to improve the health and safety of patients. The concept of interprofessional education is not new, nor is it limited to just a few professions. In June 2002, over 150 leaders and experts in health professions education, regulation, policy, advocacy, quality, and industry attended the Health Professions Education Summit to discuss and develop strategies for restructuring clinical education to be consistent with the principles of the 21st century health system. The report from this summit concluded that all health professionals should be educated to deliver patient-centered care as members of an interdisciplinary team, emphasizing evidence-based practice, quality improvement approaches, and informatics. Many experts and leaders agree that collaboration and teamwork can best be achieved if it starts early, with students from different professions engaging in interactive learning with each other. In 2009, 6 national health professions education associations formed a collaborative to promote and encourage interprofessional learning to prepare future clinicians for team-based care of patients. The organization became known as IPEC, short for Interprofessional Education Collaborative. IPEC gave the following charge to a panel of experts in health sciences and education practice: recommend a common core set of competencies relevant across the professions to address the essential preparation of clinicians for interprofessional collaborative practice. In May 2011, the IPEC Expert Panel Report was published as the Core Competencies for Interprofessional Collaborative Practice. The competencies are designed to help transform the nation's healthcare system so it provides collaborative, high-quality, and cost-effective care for all patients. Only 1 year later, in 2012, Several organizations, including the University of Arizona's IPEP program, have already officially incorporated the IPEC core competencies into their interprofessional education curriculum. At the University of Arizona, the core competencies were linked to the learning objectives in the interprofessional education mini-courses. 2012 and 2013 have been landmark years for interprofessional education. We saw both national and international organizations take deliberate action to support the reform of healthcare education and practice. On February 3, 2012, leaders from dentistry, medicine, nursing, pharmacy, and public health signed a memorandum of understanding to reaffirm their commitment to continued collaboration and leadership on initiatives related to interprofessional education and practice. In September 2012, we saw the birth of the National Center for Interprofessional Education and Collaborative Practice. The center, funded by a $4 million grant from the Health, Resources, and Services Administration, is based at the University of Minnesota's Academic Health Center. The University of Arizona is one of 10 institutions included in the grant and is an active partner in the National Center's Nexus Innovations Incubator. In October 2012, the International Pharmaceutical Federation called on every pharmacy professional association around the world to work towards interprofessional collaboration. In February 2013, the Liaison Committee on Medical Education, or LCME, approved a new accreditation standard declaring that the core curriculum of a medical education program must prepare medical students to function collaboratively on healthcare teams that include health professionals from other disciplines. In March 2013, an American Hospital Association survey on workforce planning showed that nearly 75% of AHA member hospitals are implementing multidisciplinary care teams, and another 62% are training them. In May 2013, Daryl G. Kirch, president of the Association of American Medical Colleges, gave a presentation titled, "Will the University of Arizona Lead Us to a New Excellence in Healthcare?" After carefully outlining challenges and issues the University of Arizona faces, Kirch announced that the number one thing the UA can do to be a leader in healthcare education and practice is interprofessional education. As he made this announcement, he displayed a slide featuring the IPEP logo and photos from IPEP interprofessional education activities. As interprofessional teamwork and collaboration become the norm in health professions education and healthcare delivery, the IPEP program works to ensure that the University of Arizona will be in the top tier of institutions that successfully prepare students for this changing landscape of healthcare delivery.